much, and welcome, Mr. Baum. It's good to have you before the committee. I just want to start by reiterating what I think is important news of what you've been saying today, and we all know that we have many challenges around healthcare costs. That's been our focus as we've looked at how we put in place healthcare reform that works for people, quality, but also brings down costs, and how we actually reduce costs and not just shift it around, which is what the healthcare system's done. When somebody can't see a doctor, they go to the emergency room, costs a lot more money. And, how do we make sure we're actually not just shifting costs around? But if I understood you right, you were saying right now we've got 250 accountable care organizations so far. The rate of hospital readmissions is going down, quality is going up, rate of growth per capita costs going down, and the Medicare Advantage program has seen a 10% premium reduction, as well as I've seen a 28% increase in enrollment, something like that. So, and we know that part of that is bringing down the overpayments in Medicare Advantage, which was significant savings under Medicare. I wonder if you could speak a little bit more to accountable care organizations. We have a number of things happening in Michigan that are actually very exciting in terms of the possibilities. Detroit Medical Center has been working with a group called At-Home Support to help the sickest patients get advanced support at home and prevent hospital readmissions, so that if you have an example, an 87-year-old patient with stage 4 heart disease who wakes up in the middle of the night and would normally, if they have concerns, go to the hospital emergency room, be in the hospital, come out, go to skilled nursing facility, and so on, all of which cost tens of thousands of dollars, and certainly is not the way they would like to spend their time. Under this model, the same woman would get at-home services, be able to call a nurse in the middle of the night, be able to get help, and possibly be able to allow that patient to stay home rather than go through everything at the hospital. Could you talk a little bit more about the ACOs and how you see that expanding, and the importance of really making sure those kinds of things are successful?
Sure. Well, we have been very surprised and pleased with the response that CMS received to the ACO program. The program has 250 ACOs, and we